we'll be continuing with the medical emergencies. Yes? Yeah. So where were we? We were at the chest pain. What do you mean by chest pain? Pain in the chest. So where is your heart located? To the left side, totally to the left side. Why? Then where is it? It is in the center. Okay, it is in the center, slightly tilted to the left. So whenever your pain will originate, okay, it will start from the center. Okay, will you understand Konkani and English? Yes? No? Fine. It's okay. Little bit here and there. So whenever your pain is going to start, okay, it is going to start from the center and it is going to travel. The chest pain travels. Whereas the abdominal pains, just like to differentiate, the abdominal pain is not going to travel from one side to another. Okay, this is the way to differentiate. Chest pain, whereas it will radiate. Where it can radiate, where it can go to your left hand, to your right hand also, to your back, to your neck, shoulder. Okay, so these are signs and symptoms. The pain is going to radiate. The patient will have sweating. Okay, excessive sweating. If suppose everybody is normal here, okay, are we sweating too much? No, there is proper ventilation, people are fine here. But that one person who is having chest pain will sweat a lot. Okay, kapde bhi ashe wale jatle, itle. Okay, that is another sign. Okay, sweating, the pain is going to radiate and the patient is going to feel uncomfortable. He won't be able to he will be restless. Okay. So in such situation, what will you do? What is the first aid? What do you think we can do for the patient? He can lose consciousness, yes, but then then the management will differ. Then we'll have to check pulse, breathing, and then do CPR in that way. But right now your patient is conscious, is talking to you. It's just normal chest pain, okay? What do you feel we can do to this patient? We are not giving any medicines, sorry for the voice. We are not giving any medicines here, just something we can do. Ventilation, yes, the patient is sweating a lot, so you give proper ventilation, put on the fan, AC, open the windows, doors, do not crowd around the patient, okay? There are people who will crowd around the patient, gardi kartali samki, okay? Will make the situation more worse. People who will cry, take them aside. People who are afraid of such situation, keep them aside. Okay? Give comfortable position to the patient. Comfortable position. Now what position can be given to the patient which is comfortable you feel? Suppose the patient is having chest pain. So like what position? Will he sleep? Lie down? That will increase the pain. Okay, he will basically not lie down. We will give propped up position. Propped up in the sense little bit forward. Okay, the hospital beds you can see, you can lift them up. Yes, 45 degree. Yeah, so that position we can give to the patient. So that comfortable position. However, the patient feels better. Not like how we feel better. No. However, the patient feels comfortable, we'll give that position, proper ventilation, okay. We will not let this patient walk, okay, because already there is work, heart is struggling to work, okay. This workload has already increased and by making that patient walk, what are you doing? You are increasing the workload. Workload ani vatta, patient agani tras jata, okay. So the patient, if you make them walk, even if the ambulance is right here, you will have to shift the patient by a stretcher or a wheelchair or nothing is there, at least a chair. Lift the chair up and then shift the patient. Okay, what happens if you make them walk? They can collapse, yes, because the person is right, now he was fine, after 1 minute, after 2 minutes, he is going to collapse and you will not understand what has happened. That's why you will never make this patient walk. Okay. You have to take the patient. Even though if it is from second or third floor, manage through chair. Shifting becomes difficult because stretcher can't be taken up. Okay, then you have to manage with a wheelchair or a chair. These are all first aids you can give to the chest pain patient. Second one is breathing difficulty. Have you heard about this? Yes, during COVID also we have heard about breathing. Yeah. No, you will not let them walk. You will tell the importance of not walking there. Okay, you will tell them, you will explain them what will happen if you walk. Okay, so you will say, no, we will take you. The patient is conscious, you are saying, he is giving consent. He is saying no. But you will try to explain him. Yes, try to explain him. You can see him, you can die if you go just walk there. Okay, because they will not understand that situation. So don't let them walk. You try to understand, make them understand. Okay, talking to the patient also first aid. Comforting a patient is also a first aid. Yes. So second is breathing difficulty. How do you know that the patient is breathing, or else a person who is sitting beside you is breathing? कशा कळलं तुझे फ्रेंड आता ब्रीथ करता की ना? How do you understand? You what? Sorry. Question, how do you know that the person is breathing? Check the nose. Yeah, you can keep your 2 fingers near the nose for the flow, if jata ki na. What else you can do? You can look for the chest rise and fall. Chest rise and fall. Okay, medically we teach like that. Equal chest, not even like one. Both the chest should equally rise and equally fall down. That's how you know that the patient is breathing. Even this is correct. That is also correct. So checking heartbeat is different and breathing is different. Okay, so patient आता श्वास घेता, equal chest rise and fall जाता, म्हळ्यार patient तुझो श्वास घेता, he is breathing. Normal breathing rate is 12 to 20 breaths per minute. Okay, so in 1 minute 12 to 20, that's the range for a normal adult. Okay, at rest. So within 1 minute, how many chest rise and fall happens? That's how we calculate, basic. Okay, so if this breathing rate increases due to some reason, okay, that is abnormal. Okay, but due to sports, if the patient is running, that is normal because he has done that sports and that's why the breathing rate has increased, which will settle down. So that is normal. But without doing anything, at rest, you are having breathing difficulty. So that is a problem. Again, there are some situations like asthma. Have you heard about asthma? Yes. Asthma, patient doesn't even have to tell you that he is having asthma. Looking at his attack, like if he is having an asthma attack, looking at him, you will know. Okay, because he will make noises, abnormal noises. Okay, you will come to know. तुका त्याका पोवनच कळटा की हेका asthma आसा म्हणून. And the patient is also aware of his situation. Mostly they will have inhalers with them. Yeah. So what you can do, you can ask them if they have the inhaler. If they have the inhaler, give it to them. Let them take that pump. Okay. This thing we can do. Again, same comfortable position to the patient. Proper ventilation. Do not make them walk. Same. First aid remains the same. We are not giving any medicines in first aid. Okay. So yes. Seizures. Have you heard of this? Seizures. What is the other word for this? Fits. Yes. Fits. Common language, people know about fits. Seizure is a bit medical word, terminology. So what part of the body, which organ is affected here? Which organ is affected? Where is the problem? Yes, nervous system, your brain. Your brain is the problem here. Okay. So why? The proper definition of this is uncoordinated electrical activity of the brain. This is the definition. Okay. Let me explain you in a simple words. If who is giving me commands to like walk, to talk, to eat, everything my brain is giving. Brain is my boss. He is telling me, he is giving me signals. But if this brain is giving me 100 signals at a time, will I understand what to do? No. So this happens here. It's uncoordinated electrical activities. So like multiple signals are coming from my brain and I am not understanding what to do. Whether to walk, whether to do this, that, I am not understanding. Okay. So here now your body is going to jerk. Full body fits at full body jerks at halta. Okay. So suppose a patient has fallen down here, right here, is full joking. What do you think we can do for that patient? First of all, this scenario will become very difficult, like sometimes scary. Okay, scary to watch also. But still, what help we can give to the patient, you think? Yes, very good. Okay, so the first thing is to clear the surrounding. So what I'll have to do, take this table away, take these wires away, because these wires can cause, this table can cause secondary injury. Because the whole body is joking, he is unaware, the patient is unconscious basically, and he is unaware where he will go. So he is going to hurt himself or herself. So you will remove the surrounding, you will clear the surrounding. It's the first thing you can do. Second thing you can do is to keep a cushion or pillow below the head. Why? Because the head is also jerking, head is also banging to the floor, which will cause secondary head injury, and that will be more dangerous. So that's why you will keep something cushion. You can roll a towel, bed sheet, kide barik she, vadle usha dorap na, barik, small. Okay, you roll the towel or whatever and keep it beneath the head. So that gives proper support, protection from banging the head to the floor. This is the second point. Third, what you will not do. There are myths, people do some things to stop the fits. What do you think people can do? There are things people do, no? At the home. Sorry, to the tongue, something you said. Ruler, yeah. They put spoon also in the mouth so that the tongue biting shouldn't happen. That's the reason. And what else? In the mouth? No, they give smell. Yes. Not in the mouth. They give smell. Yeah, correct. What else? Hatin chavi dita. They give keys in the hands. So what they feel, by doing all this, the patient is going to become better. Okay? But these are all myths. You shouldn't do this. Okay? Neither you will hold the patient like this. चार मनशा चार जाणांक धल ताका धरला आतां चारी कडल्यान दोनूय पाय दोनूय हात. Okay? This is wrong. You shouldn't do this. This is not going to help the patient. What is the problem? The problem is in the brain. How are you going to stop that? See, fits, generally seizures, it will stop automatically. Even if you don't do anything, they are going to stop. They are just for few seconds. If the patient is having first time fits, they will stop automatically, even if you don't do anything. Okay? So what do people feel? That they have done this, they have given some onion smell, sock smell, that's why the fits have stopped. Okay? That doesn't happen. That's the brain. The brain is handling everything and brain is only stopping it. So even if you don't do anything, it is going to stop. So never do all these myths, never hold the patient like this. Okay? It will only harm the patient. Even putting the spoon into the mouth is wrong. Some people put the fingers into the patient's mouth. Now what is going to happen? Now their fingers are going to be bitten. Now we have a second patient. Yes? So we will never do that. Okay? Even if tongue biting is happening, we can cure that later. Okay? Now, once the fits are stopped, you have cleared the surrounding, you have kept a pillow under the head. Now the fits have stopped. What will you do? Yes. I'll come up to that. Yeah. Now the fits have stopped. Your patient is still lying down. He is unconscious. Now you will give position. Give left lateral position to the patient. Left lateral in the sense, tilt the patient to the left side. Okay? Left, right, chalta kide. But mostly we go to left side. Why? Why are we giving position? See, lying down on your back flat, that is called supine position. Supine. Lying down on your stomach, that is called prone position. Lying down in the lateral, left lateral, right lateral. Okay? Now here, after the patient's fits have stopped, we are giving him left lateral position. Why? Because there are froths also, there are secretions in the mouth which will come during the fits. the fits तोंडान फेस सुद्दां येता पयला आसतलें. Okay, so what happens, those secretions again will go inside your lungs. That word is called aspiration. Okay, the patient die because of aspirations. Aspiration म्हळ्यार कितें, any foreign object that will enter into your lungs. And lungsan कितें वचपाक जाय, only air. But in this situation what will go, all the secretions, they will go into your lungs. That's why we give left lateral position so that the secretions will come out automatically. Okay, so that's why giving positioning is important. Mostly people, yeah, let me finish. Yeah, you can ask. They put something, what? Cloth in the mouth. No. No, again, if that is happening, it's a myth. You shouldn't do it. Okay, you're blocking it, no, basically, if you're putting a cloth or something. You just give a left lateral position, it will come automatically outside. Okay, or at least it will prevent from going into the lungs. If it is not going, if it is not coming out, it will not go inside also, because you have given left lateral position. If the patient is lying like this in the supine, then it will go, obviously. It will go into the lungs. Patient will aspirate, he will die. This is the main reason people die. Okay. So then, this is the definition. Jerky movements, the whole body is jerking, or else it will be still. Causes fever in children. So even the children's, okay, the small children's will also have fits. And the main reason they will have fits is high fever. Temperature janna vatta. What is the normal temperature? 98.6 degree Fahrenheit and 37 degree Celsius. Both are same. So above this, when your temperature rises, it is considered as fever. So whenever a child is having fever, you will have to control it. So basically what we can do in the home, before even going to the doctor, what do we do? Even if we have a fever, what do we do to reduce it? Homemade remedies. Cold sponging, okay, घडयो दवरता उदकाच्यो कित्या खातीर, temperature देंवपा खातीर. Okay, that's what we can do for the children also. Okay, you don't have to immerse the whole child into the bucket of water. Okay, you will just have to wipe the whole body out again and again with normal water, not even like cold ice cube water. Okay, normal temperature water. You have to clean so that the temperature reduces. Okay, even after doing all this, the temperature is not reducing, then you have to go to the doctor, obviously, because it is very risky. You will not even understand if they had fits and like what, because in adults the whole body is jerking, but in kids what happened, they will just move a finger. They will just move a finger and that's it. You will not even notice that they had fits. So it's very risky. You always take a child who is having high fever directly to the hospital. Never keep them home. The last one, yes. We can only control that fever, no, like cold sponging. This much only we can do at home. Yes, nothing else. Nothing more we can do in first aid. Just try to reduce the temperature. The last one, epileptic fits patient which discontinue drugs. Epileptic is another word for seizures. Okay, seizures, fits, epilepsy, convulsions. These are all same. So sometimes these patients, they know that they have this fits problem and they take medicines for it. But suddenly if they stop in the middle, this problem can arise again. Okay, so you can ask the patient if the patient is conscious, or else the relative if he has a history of seizures. So that's what it means. Okay, so the solution, the first aid here is clear the surrounding. Second, keep a pillow, and the myths I have told you, already explained. Okay, any questions? Yes. Next, hypoglycemia. What is hypo? What is hyper? Hypo is less, hyper is more. So glycemia is sugar level. Hypoglycemia, less sugar level. Okay, so these are all the signs and symptoms which are given here. First, if a patient is having hypoglycemia, what are signs and symptoms we can see? Shaking, your patient is shaking, is thirsty, is hungry, anxiety, is doing, he will have dizziness, he might faint also. Yes, these are all signs and symptoms. The patient is all fine, but one day he is doing samko chid karta garan. Okay, that means his sugar level has decreased. You have to give something to eat. So now to increase the sugar level, what do we have to do? Give sugar. Sugar level has decreased, so we have to give sugar. How do we give? Sorry. Sakaracha udik, sugar water, right? So how much water we take and how much sugar we take? How much sugar we take? How much water we take? Simple question. 1 glass of water and how many spoons of sugar? 1. Yeah, so here, sorry, fruit, basically here you give something which they can drink, let them be fine. Yeah, juices. Okay, then chocolates also you can give. Okay, juices, chocolates, sport drinks, sugar water. Okay, so now coming back to that question, why we take 1 glass of, yes, you have any question? You want to write down? Write down. Fine. Okay, write down. I'll explain. You can see, right? You want me to shaking, sweating, anxious, dizziness, hunger, fast heart rate, impaired vision, weakness, fatigue, headache, irritability. So these are all the signs and symptoms. So you give good amount of, you put good amount of sugar, not only just 1 spoon, put dissolvable amount of sugar in that water and give. Okay, because if you give only 1 spoon of sugar, the sugar is going to rise and again it is drastically going to fall down. That's a good amount of sugar into water and give. Then sweet drinks, chocolates you can give, anything which can basically increase the sugar level. Main. It depends upon the patient, like how he is. It depends upon the patient. It varies. Yeah, dizziness also. Patient will be hungry. Patient will be irritable also. Yeah, main symptoms. And fast heart rate, you can just see the pulse and check if it is beating too fast. It is a bit late. Yeah. Allergies. Okay. Next is allergies. What allergy does this girl have? You get the picture. She has allergy of pollens. Yes, most common. What else are the most common things? Dust. Yes. Pets. Yes, pet dentals. And काय ना गो? Foods. Yes, foods. Medicines and sorry, what is he saying? I can't hear. Stings, he is saying. Stings. Okay, basically anything. Basically anything in this world can be a allergen. That substance which causes you allergy is called allergen. Okay, so anything in this world can cause you allergy. Until and unless your body reacts, you will not understand that you are having that allergy. Okay, so here you don't have a first aid as such, but it's like basically recognition, protection yourself. If you know that you are allergic to something like mushroom, you are allergic to mushroom, you will not eat it. Okay, otherwise you will, suppose a room is filled with some poisonous gas. Okay, you can't remove the gas, you will have to take the patient away of the room. So you will remove the danger or you will take the patient away from that. Okay, so depending on that, you have to see. But there are some signs and symptoms. Signs and symptoms can be your skin is going to turn red, there will be itching, there will be swelling, there can be rashes, and very severe thing, patient can also have breathing difficulty. Once the breathing difficulty starts, you have to take the patient to the doctor. Okay, so your skin is going to turn red, but what is your normal skin color? It is going to turn red. But what is the normal skin color of a patient? Of yourself? No, don't look at like this and it's not brown. It is pink. It is pink. Everybody's normal skin color is pink. Okay, and where do you check skin color? To the eyelids, in the oral mucosa. You check color there, not looking at the skin. Okay, so everybody's skin, normal skin color should be pink, has to be pink. It can turn abnormal or red, blue, yellow. Yellow in jaundice, in blue when your lack of oxygen, and suppose the discoloration, blunt trauma, there is no bleeding, internal bleeding, that time bluish it happens. Yes, so these are all abnormals. Okay, so these are few signs and symptoms, and the first aid is basically to stay away from the allergen. Fainting. Now this cases you all might have seen. Okay, this might have also happened with few of the students. Okay, fainting. What is fainting? Brief loss of consciousness for a period, short period of time. For a short period of time, unconscious the patient. Okay. Now again, problem with the brain, blood supply is not happening to the brain. That's why. Okay. What else reasons can be? You have not had your breakfast counter. Okay. You have not had food for long time. You are standing. Where my blood is going now? I am standing from so long. Where my blood is going? Due to gravity is going down. Your legs, it's not going up to the brain. Okay. So there are many n number of reasons where a patient can faint. And once he is fainted, he is fallen down here. What do you think you can give? What do you think you can do to the patient? Ventilation, fine, okay, ventilation, proper ventilation. Yeah, you can sprinkle water, still is not conscious, then? Yes, madam, very good. Yes, this? Yes, raising both the legs up to 30 degree, 12 inches, okay? Not 90 degree, so that patient becomes fine quickly. No, not 90 degree, it is just 30 degree, okay? So what happens here? Now the blood is traveling back to the brain. Now this will work as magic. Okay. So once the blood is coming back to the brain, patient will become conscious. You can sprinkle water, that is fine. But when the patient is unconscious, you will not give anything to drink. Because he is unconscious, you will not force him to drink anything. Okay. No giving, nothing to be given, to eat and drink unless is unconscious. Okay, let him be conscious, then you give something to drink. Okay, even when he is conscious, make him sit for at least 15 minutes, give him water to drink, and then again after 15 minutes let him walk and go. Okay, so this is the first aid for fainting. Okay, this position is shock position. The name is shock position. Okay. Stroke. What is stroke? What is the other name for stroke? Write this down. Write this down. It's important. It is fast. Mnemonic is fast. F-A-S-T. T is time. Write it down. Fast. Stroke. Stroke म्हटल्यार कितें? Stroke. What is stroke? Where is the problem again with the body? Brain. Yes. The problem is brain again. Stroke is paralysis. Okay? Paralysis, medical term is stroke. Here again, we do not have any first aid as such to give to the patient, but early recognition. you identify that the patient is going to have stroke. That is important. Identify and shifting to the appropriate hospital. Okay? And how will you identify? We have 3 points here. Fast. F-A-S-T. F is facial droop. What will you do? Tell the patient? You will tell the patient to smile. Yes. You tell the patient to show your teeth. Okay? So, if you tell the patient to smile, if suppose example the right side is affected, this side is not going to move. Only this side is going to move. I cannot enact this. Okay? Just imagine. This side is not moving, only this side is moving. This is one sign, facial droop. Second, arm drift. Now what you will do here? You will tell the patient to close his eyes, his or her eyes, and raise both the hands like this and wait for 10 seconds. Okay? Wait for 10 seconds. Like 1, 2, 3, 4, like this. 4, 5, 6, 7, 8, 9, 10. Automatically, this hand is not under my control, so this is going to come down. And this hand is going to remain there only because this is under my control. Okay? So since my right side is paralyzed, this hand is going to come down. Second side. Third is slurred speech. Slurred speech is you will tell the patient, or you can ask the name, or tell him to say some simple statement. Sky is blue. It includes everything. The patient has to be transported, the CT scan has to be done, all the reports have to be done, and the treatment has to be started. So that the patient recovers quickly. Obviously, paralysis patient don't recover quickly. But to make sure that the patient has reached as soon as possible to the appropriate hospital. Again, I have said the appropriate hospital because only few hospitals have CT scans, government hospitals. So basically in north we have Arzano, North District Hospital. In south we have Hospital Hospital and Emergencies Hospital. Usually once great ambulances we shift the patient directly to these hospitals because the CT scan is available there. Without the CT scan, the treatment can't be started. So don't take the patient to nearby PHCs, CSCs and waste your time. Waste the time period. Take the patient to appropriate hospital where CT scan is available. Just remember this. Okay? So घर आदमी का कहना है कि you should be aware of कौन-सा hospital पर भाग जाए तो खबर असर Okay? Fever discussed here. Fever is high temperature. Normal temperature total 98.6 or 37 degrees Celsius. But yeah.
What's the reason that someone gets a stroke?
Okay. So stroke when something when people there are 2 types of stroke. Either ischemic stroke or hemorrhagic stroke. Ischemic stroke is where there is clot. The clot. This clot blockage due to some reason. Okay, there is blockage and there is no blood. The blood supply shut down. Either that can be a reason or it can be hemorrhagic. Hemorrhagic is bleeding. Accidental. Okay? If accident has occurred and there is some bleeding and the bleeding is happening, internal bleeding is happening. So these are inside the brain. Brain. Something is wrong with the brain here. So these are the 2 reasons. Mostly 70% it is ischemic stroke. 30% hemorrhagic stroke. Accidental. Okay? So it happens. So where that clot is or where that bleeding is happening, only the CT scan can tell you. No other test. That's why I said appropriate hospital. Yes. Yeah. Yes. We have already started this. We have already implemented this. We have told all our ambulances to take all the stroke patients directly to these hospitals, major hospitals, not Asilo, Hospicio or SGMC. They do not take to PHCs and CHCs. If that's the answer you're expecting. Yeah. So we have actually started doing this. We are shifting all the patients to that hospitals. Okay. Okay. Fever, high temperature, again you can do cold sponging, normal. Okay, medicines, again we are not involved, medicines are not involved in first aid, but do cold sponging. Even that, if that is not happening, you will have to go to the doctor. Nothing much we can do here. Headache can be of multiple reasons. Lack of sleep, stress are major reasons. Okay, again good diet, good sleep, taking a good activity, physical activity will help you. Okay, so nothing in detail as such. Dehydration, what is dehydration? Dehydration is lack of water, less fluid intake. So basically stay hydrated, drink a good amount of water daily so that you don't get dehydrated. How will you know that the patient is dehydrated? Skin, that is called skin turgor, and redness, weakness. The patient will be weak. Yes, that just like ma'am told, skin turgor. When you pull the skin up, the skin is going to remain like that only. Okay, that is a sign. Your mouth will turn dry. Usually it should always remain wet. Okay, when your mouth turns dry, that is a sign of dehydration. Pregnancy. Pregnancy, we are not going to tell you about deliveries and all. We are just going to teach you about how to shift. If you have to shift a pregnant woman, you will shift that pregnant woman in a left lateral position. Left lateral means you will tell her to sleep at left side and then shift to the hospital. There is a reason for this also. When the pregnant woman is lying on the flat back, okay, her uterus, because of the baby, that pressure is not letting the blood supply to the mother. That blood supply is reducing. It is pressing that vein, okay, inferior vena cava. So that's why the mother's BP will become down. If the mother will go into hypotension, BP low jata. Okay, that's why we tell the mother to lie down at the left side and then we shift the mother. This is the reason. There is that this thing is called supine hypotension syndrome. This happens. To avoid this, we tell the mother to sleep in the left side and then we shift to the patient. Nothing more. Choking. What is choking? It is not this picture. What is choking? Something is stuck in your throat. Okay? There can be partial choking, there can be complete choking. Partial choking is when happens when you are eating something and it's stuck and your body's response is to cough it out. Okay, cough or vomit it out. It comes out and you are fine. That is partial choking. But complete choking, when it is stuck here and both your food pipe and your windpipe is here only, right? So it's totally blocked. Now it is not going inside, now it's not even coming outside. It's totally blocked. You can't talk, you can't breathe, you can't do anything. Okay? Worst situation. You can't be able to talk, you won't be able to cough, you won't be able to breathe in such situation when complete choking happens. There is a technique we will show you that is called abdominal compression. Abdominal compression. This is for adults. For infants, for small infants, the technique differs. We have a different technique. We'll teach you that also. But this technique is abdominal compression. Okay? And in this, I'll require one volunteer. Who is ready to come? Female. Volunteer. You don't want to learn this? Yes. Thank you, ma'am. Stand here. Face face like this. Do like this. Yeah. Okay. So this is my patient. This is a universal sign for choking. If any patient is holding like this, you know that she is choking. But still, you have to ask. Consent. Okay. First is, are you choking? Yes. If she is saying yes, she is not choking. Oh. Okay. Because just now I said. Okay, because just now I said you won't be able to talk. Yeah, you won't be able to speak, you won't be able to cough, you won't be able to breathe. You just have to nod. Yeah, just nod. So she is nodding. So she is choking. Second question, do you need my help? Yeah, because if she says no, I can't just go away. Okay, I have to wait, call ambulance and wait for help, or else convince her to take my help. Okay, I will not force her to take my help. If saying yes, I will help her. Okay, say yes. Okay. So she has said yes. Now you have to give position. Position is, you will tell her to spread the legs little bit. No. And I will keep one leg in the center like this. If you all can't see, we can do it again in the practicals. Like this. Now why this position is given? If she falls down, I will support her. She will not directly fall down on the ground. Okay? Next thing I have to do is feel her umbilical region. Bombly. Okay? Bombly feel करपाची त्याच्या वयर. 4 finger distance up. Make a fist. Keep it here. Second hand you have to wrap. Okay? And give inward and upward pressure. Inward and upward pressure. Inward and upward. Okay? Thank you. We don't do it actually because it is a painful process. Hamlich maneuver, yes, yes. Same it is. Hamlich maneuver and abdominal compression, same. Yeah. I'm showing again. I'll show again. Okay. So this procedure we don't do it. We will just enact because it's a painful procedure. Okay. So again, patient is standing like this. I have kept position. I feel her umbilical region. Bombly feel karpachi. There's a 4 finger distance. Where? Okay, there's a diaphragm. There. Make a fist. Okay. Place it here. Second hand you have to wrap. Okay. Your thumb should place here. Second you have to wrap and give inward and upward. Inward and upward. Just like the picture. That the object has to come out. It has to be little bit forceful with pressure. Okay, it is a painful process again, I am telling. That is for infant. Yeah. Tapping also you can do, people still do tapping on the back. But that will help your partial choking. Complete choking is not going to help. So this is tried and tested. People have done this. Okay? Yes, relieved. That's why. But people are not aware of this technique. So that's why we teach now. Okay? So this is called abdominal compression. In 2 conditions you will not do this. When the patient is pregnant. When the patient is pregnant. If you see a married woman, the third question will be, are you pregnant? If she says yes, you will not do it. Second, if the patient is obese, motosa, hath pawa na. You will have to do chest thrust. Center. Technique remains the same, only the location changes. So center. Chest thrust. Chest thrust. Okay, this is not effective, but something is better than nothing, that's why. So chest thrust you have to do for these 2 patients, obese and pregnant. Everything remains the same, just the location changes. Okay, in these 2 situations you will not do this.
The person is not able to respond. How will she tell you she's pregnant? Or how will you know?
If the patient is unconscious.
Not unconscious, she is conscious, but she cannot tell you.
She can nod at least, no? Not like responding. She's not talking, obviously, but she can say yes or no at least. She'll be in that position at least. Okay? So yes, so this is the thing, choking. For 1 year and below, the technique changes. Okay, the technique is different. We'll show that later. So what is the name of this technique? Hamlich maneuver or as abdominal compressions.